Welcome, everyone. Thank you for joining us. Our webinar presentation today is entitled Epigenetics, Telling Your Genes How to Behave. Our guest speaker is Dr. Ann Shippy. My name is Lenore Powell. I'm a medical education specialist in Genova's Atlanta branch, and I will serve today as your moderator for the webinar. We would like to welcome Dr. Ann Shippy. Dr. Shippy is board certified in internal medicine and a certified functional medicine doctor. After a decade of working as an IBM engineer, her challenging experience with traditional medicine motivated her to search for her own health answers. So she left the field of engineering to attend University of Texas Medical School. Her interests and areas of expertise are autoimmunity, neurology, gastrointestinal disorders, infertility and pregnancy, and environmental factors such as mold toxicity. Dr. Shippy has a thriving practice based in Austin, Texas, and is the author of 2 books. The presentation slide deck will be available on our website within a few days of the webinar. You can access these resources, previous webinar recordings, brief video modules, and other materials by clicking the Clinicians tab on the home page. All right, I'm going to turn over the role of presenter to Dr. Shippy.
Hello there.
Hello, you sound great.
Oh, good. Let's see, show my screen. Here we go. Can you see me?
We can see your screen, perfect.
So I am really excited about this topic, and preparing for this talk allowed me to really delve into the latest and greatest research that's coming out and have that together to share with you. It's really, I think, where medicine is going to be going in the future. So I'm going to be reviewing the basics about epigenetic influencers, and then how we can really be modifying gene expression through more precise, targeted, and individualized interventions with a couple of case studies, and then how to monitor our effectiveness. So just to clarify some definitions, because there's so many of these newer terms floating around out there that can be kind of confusing. So epigenetics literally means above the genes, and it's the study of chemical changes that influence, modulate gene expression or cellular phenotype through mechanisms involving how the DNA is packaged and expressed without any alterations to the genes themselves. It's really the essential aspect of regulating normal cell function. So I think seeing it graphically kind of helps. There are 3 main epigenetic mechanisms. The first one up here is the histone modification. The second one is the DNA methylation. And the third one is direct mRNA interference. I think there's going to be a 4th one coming, and I'll share that with you in one of my case studies. So the histone modification is really being linked to a lot of the cognitive issues that we're seeing, the long-term memory issues, and then the methylation is in so many different areas that I'll cover. The nutrigenomics, that was my first exposure to, oh my gosh, we can actually start influencing what our genes do based on what we put in our bodies. So it's basically looking at the detailed mechanisms that happen from the food, that actually helps our bodies to work better, as well as detrimental or even nutritional deficiencies. And I first got to go to there was a nutrigenomics conference about 14 years ago. Bruce Ames, one of my heroes, had organized an entire conference on nutrigenomics at their new nutrigenomics center at UC Davis, and it was just mind-blowing at the time because I was just barely getting into functional medicine at the time. Then metabolomics, I think, is also going to end up being a term that we're going to hear a lot of, because we can, with all the increase in environmental toxicity that we're seeing, it's going to be one of the ways that we're going to really be able to detect physiological changes at a cellular and metabolic level that's going to help us to know how these toxins are really influencing a person's physiology. And then proteomics is the study of proteins, which is also another way that we're going to really know what the impact of all of the chemical messengers are in the body. And then one of my favorites is the exposome. So that's the cumulative measure in a lifetime and actually even prenatal, and how those environmental toxins are relating to health over the lifespan of a person. So I picked this article. It was written in 2006. It's a really just good article to set the tone of even 13 years ago where things were within epigenetics. And then if you go on PubMed now and just put in the word epigenetics, I didn't look this morning, but it's thousands of articles even just in the last couple of years. So there's been such an advancement in this. But even in 2006, the evidence was really accumulating that we weren't just stuck with our genes, we were really having our lifestyle and our environmental exposures. Even back here, they're talking about heavy metal, pesticides, diesel exhaust, tobacco smoke, POHs, hormones, radioactivity, not just having a direct impact on our cells, but influencing how the genes are being modulated. Then I picked a couple of really hot topics to cover. One is what's going on with the ApoE, and I think most of us are looking at ApoE genes and the people that we think are most susceptible to Alzheimer's disease. But what I love about this study is that they're looking at the epigenetic aspect of this. It's not just do you have this gene or not, but what are the things that are going to be able to modulate and hopefully improve a person's risk if they do have the ApoE4 gene. So, you know, we see it. We see people that are very cognitively adept into advanced ages with these genes that are supposed to be detrimental, as well as, you know, to the other extreme where we see the early hit for Alzheimer's. So of course it's really curious, what is it that's making this one person be affected and not the other? And so these studies are really looking at the methylation of the genes. That part of the epigenetics has a tremendous impact in what the person's risk and phenotype ends up being. So I think this is going to be very exciting as we're able to measure these things in the future. Then as far as the traumatic brain injury, also with the certain ApoE genes, there's an increased risk for having a bad outcome from a TBI. So I think this actually, you know, those of us that are parents or are taking care of kids, I could see at some point that will be kind of risk stratifying early on, even with what sports a kid may play, or being able to really know that their methylation processes are working optimally, and before they would do things like play football or soccer, mountain biking, the things that have the biggest risk for TBIs. And then a little bit more on the TBI, just really linking the environmental exposures and then the DNA with the risk for the chronic traumatic brain injury rather than recovery. So I think this is going to be just a very exciting area that we can get better outcomes when people have had the traumatic brain injuries. And another one of my favorite topics, and there was so much research going on in just the microbiome in general, thousands of articles, but then when we link the topic of the epigenetics and the microbiome, oh my gosh, this really changes the way that I think about getting the microbiome optimized in my patients. So this article talks about the epigenetic impact of the microbiome on obesity and cardiometabolic health. So it's just a change in the lens. You know, we know the direct impacts that people need a healthy microbiome, but now if you even take it that step further to have the healthy expression of their genes, they need to be aware of what's going on with their microbiome to either prevent or treat the obesity and cardiometabolic. And then I think a lot of us are aware of how the microbiome influences the mental health, but it's also very clear now that the microbiome has a influence on the epigenetic changes that then lead to the psychological changes. And a lot of this is through the DNA methylation and the histone effects of the microbiome. So, I think some of the most difficult patients are the patients with inflammatory bowel disease. And so I think a lot of this research is going to help us to help those patients even more by helping to be able to look at the role that the diet is playing in then regulating the microbiome, and then the microbiome impacting what the gene modulation is. I have a nice little diagram here. So I would, this is from that study, but I would do it even a little bit differently. But we can see that, the person's genetics themselves, especially on the immune system side, what their lifestyle and nutrition is impacting what their microbiome balance is, then influencing the genes and causing the disruption in the mucosal barrier and the immune dysregulation leading to the inflammatory bowel disease. So I think, to me, it just helps to see it in this way. And then I think, of course, we should have some more direct arrows here with the lifestyle and nutrition and with the genetics, but can see that link. That epigenetic role is, I think it's really the wave of the future, and being able to take each person's individual genetics and then see how we're doing in the future. And then there's been so much research coming out about how important the mother's microbiome is, and having the vaginal birth and breastfeeding and skin-to-skin contact for the baby to get established with a good microbiome. And now there's even evidence showing that part of why that's so important are the epigenetic changes that occur with having a healthy microbiome or even a non-healthy microbiome, and what the long-term development health issues are for that child. And then with there's so much about, since we have such an epidemic of diabetes, metabolic syndrome, and obesity in our country, there's a lot of work really going on with the microbiome and how we can shift the microbiome to help to get to a healthy insulin state with the patient. So, if you're working with somebody on their blood sugar, that's got to be something that that we take a look at, not just what are they eating and how is that affecting their blood sugar, but what's going on with their microbiome and how can we optimize that to help them have better blood sugar control and metabolism. So with the inflammatory bowel disease, I think it's really fascinating that there are 200 genes that have been linked with inflammatory bowel disease. So, we really have a big data problem where we're going to need to be able to look at things in a bigger scale with all the different variables that can be affected. And I think it's very exciting where we're going to be seeing inflammatory bowel disease going in the future from this data, rather than just the mainstream approach to just do the immunosuppressants. And then there's such a link with autism and the microbiome and other nerve and developmental disorders. So again, I think it's really exciting to think, okay, this isn't just the direct microbiome impacts, but it's how the microbiome is influencing the gene expression of the patient and the development of the brain. I think it's very, very important to be addressing the things that we find on the microbiome and gut studies. And then here it is again, the microbiome with the development of cancer. It's not just the organisms that we're seeing associated with the increased risk for cancer, but the effect that those organisms have on the genetics. I like this diagram because it shows a couple of key things with inflammatory bowel disease. So we can see, that there's the issues where we have direct damage. So that would be from something like mycotoxins or glyphosate. So the toxins that are commonly ingested. But then we see certain organisms either causing DNA hypomethylation or hyper. So it's really about balance between the hypo and hypermethylation. And then we have antibiotics that can really mess with the histones, and then certain organisms that affect the mRNA. So I think this is such an exciting field because we're going to be having better and better answers for doing the prevention, and it's ultimately going to be getting back to having keeping as healthy of microbiome as we can. A little bit more on the role of autism and how important it is to have plenty of the antioxidants with the correct microbiome. I think we're all aware of what's happening with the endocrine disruptors and the rate of infertility and the birth defects and all that kind of thing. But again, we're seeing now that that's not just the direct impact of the endocrine disruptors, it's the epigenetic changes. And then unfortunately, with those epigenetic changes, those do get passed on across generations. I found this absolutely fascinating with the risk for breast cancer and air pollution. So they're showing that there's epigenetic changes that happen, down to these detailed molecular levels that I hadn't even heard of before. So this gets you thinking about, okay, well, what do you do to have the lowest level of air pollution that you can? What city do you live in? What roads do you live by? What kind of filters do you have in your house to reduce the risk, especially since we're seeing such an increase in breast cancer? Smoking in prenatal is kind of old news. Of course, that came out in the 70s, but they're still looking at this, and what they're seeing is that some of the effects of the smoke is affecting the gene DNA methylation. So again, to me, the smoking kind of goes along with air pollution, and we really need preconception and prenatal. We need to be having the cleanest environment for the parents as possible. And then they're also looking at this with the link to male infertility. And then the epigenetics of autoimmunity, there's a lot of exciting work going on that, and especially the effects of the microbiome and environmental toxins. And then just that reminder, we all really need to be exercising at least every 48 hours for, at least that 15 or 20 minutes, because it changes not just our metabolism for the time, but it's actually an epigenetic change as well. So next time you're exercising, just think about that your genes actually expressing themselves better. And then another super fascinating area of study is the epigenetics of aging, which I think we're all interested in aging better. So there's looking at the epigenetics of, getting the methylation just right. And I'm going to be really excited to be working with the new panels that Genova has out to explore the methylation panels in a little bit more detailed level than what we've been able to do in the past, and look at some of the genes. Then there's a lot, there's been a lot of discussion around intermittent fasting, caloric restriction, the fasting mimicking diet, and the data is extraordinary on how beneficial that is to do, especially the work coming out with Valter Longo and Prolon, really helping to prevent cancer, change autoimmunity. There's even an article that just came out on how it's shifting the microbiome significantly. So there's so much good information on this topic. And I selected this article because of the detail of it, not just having the effects of the autophagy that some of the other studies are showing, but it's actually kind of cleaning up some of those genetic markers and instead of having the methylation decline, actually showing some reversal of that. And I guess that's really the message with all of this, is that because of this field of epigenetics coming so much to the forefront, it feels like everything is so much more reversible, because when you just think about these markers getting turned on or off or modulated, it all seems so much more durable. And one of the things that I think is going to be critical as our environment is getting more and more full of environmental toxins is what's happening on an epigenetic basis with the toxins. So I pulled this study that's looking at the bisphenol, and it's a humanized mouse study, but and again, it's looking at stuff that I've never even heard of, these H3K27 levels, but it's getting a better understanding of how the gene expression is changed, the epigenetic is changed with the BPA, and showing the increased risk for atherosclerosis and cardiovascular disease with perinatal exposure. Then carbon-based materials, these are used in a lot of medical and biological systems. They have the direct impact with the neurotoxicity, hepatotoxicity, et cetera, but then also the epigenetic effects. And one of my favorite topics is the effects of just mold in general. So aflatoxin is one of the mold mycotoxins, and in addition to being incredibly genotoxic, nephrotoxic, immunotoxic, all the toxics, it's also there's also evidence now showing that there's the epigenetic changes that are probably also having a severe impact on why people are getting so ill and also causing cancer with these mycotoxins. So I've got a couple quick case studies for you. The first one is a 44 college professor. She had a history of infertility, PMS, migraines, allergic rhinitis, and irritable bowel syndrome. And she had a mild concussion. She just had a gentle bump to her head, but then was not getting her memory back. And this was very concerning as a college professor doing, pretty substantial research to feel like she was losing her mental capacity. So in our workup, she had a little bit low B12, but not enough to explain what was going on, a little bit of a higher iron, again, nothing that was screaming of hemochromatosis. She did have an elevated lead and mercury, significant dysbiosis with the parasite and the candida, elevated trichothecene and gliotoxin, so two of the mycotoxins, a low magnesium and zinc. She showed evidence of hypomethylation by the estronix and methylation pathways, and she was heterozygous for both of the MTHFR genes that we tested. So fortunately, I was actually able to get quite a bit of data on her, and so we did her detoxification genes. So she was CYP1B1. That probably explains the more susceptibility to the mycotoxins as well as the heavy metals. And she also was heterozygous for the COMT, one of the NATs, but look at her glutathione genes. So she, especially with the environmental exposures that she was having, sure her body was struggling with keeping up with the glutathione. And then as far as being able to clear the free radicals, she was homozygous for SOD2. We had some of her chemical levels with some of the volatile solvents being a little up there. None of the pesticides were elevated. Her bisphenol was actually elevated. Maybe that had a role in some of the infertility. And phthalates a little bit up. So what we did with her is we corrected her dysbiosis, really helped her with supplements that would support her detoxification. She actually ended up with a pretty big mold issue, and I think that was a lot of the susceptibility to her her TBI not healing, the concussion not healing quickly. We repleted her nutrients, and we had her do about 40 hyperbaric sessions. And in this process, I think we really addressed the epigenetic influences, and she's done really well, probably having found some of these things better than ever. So some of the epigenetic influences, I think, were some of these detoxification SNPs, the environmental exposures, and the accumulation in her body, the microbiome with the infections and dysbiosis. Very stressful career, so having her meditate and do some neurofeedback, I think, and then also this tendency for hypomethylation. Then the next study is a woman with hyperparathyroidism. She had a kidney tumor called oncocytoma. It's not a very common tumor. It was benign. It can be malignant, but hers was not, and so she'd had it resected. Some nervousness around this because her mother did have a renal carcinoma. She had a hypothyroidism, irritable bowel syndrome, and she came in really not feeling right. She was having some night sweats. She was gaining weight without changing a thing, a little bit of loose stools, really, really craving sugar, getting infections easily, including tooth abscess, was feeling really tired, and she had been quite avid with exercising, but she really was finding that she couldn't exercise very well. And so I've just picked the pertinent labs here. She definitely was having some evidence of the hyperthyroidism being fully active. She had had it diagnosed several years before she came to see me, but really didn't want to go through the surgery, so she'd just been monitoring it. And she actually came back for quite a few organisms. She had Ascaris and Trichostrongylus and Candida, some pretty significant dysbiosis with the bacteria, including, and then also a low IgA and a low butyrate. I was concerned about a potential immunodeficiency since she was having these recurrent infections, but everything that I checked came back normal there. Her MTHFR, she just had one of the SNPs with the C677T. She also had some phase 1 issues with CYP1A1 and B1. She was homozygous for COMT, had a couple of the acetylation polymorphisms, and also here had some pretty significant findings with the glutathione SNPs. Her saving grace is probably that she doesn't have any of the SOD polymorphisms. And she had some signs of at least a little bit of a benzene exposure. And then she had some old PCBs, that really shouldn't be around anymore. Looked pretty good for the organophosphates, but then was having some of the BPAs and triclosan pop up. She was pretty nutritionally deficient. She had quite a few low nutrients, which was really interesting because she was already taking quite a few supplements. So she definitely was not absorbing well. She had pretty high lipid peroxidases. I'm good with this level of CoQ10. A little bit elevated 8-hydroxy-2-deoxyguanosine, which makes me a little nervous. And then was showing a little high on the mercury. And then this is pretty significant here with the dysbiosis markers. You can tell her microbiome was a wreck, especially from a fungal standpoint. She had some signs of the some mitochondrial dysfunction, and I consider this as looking on the stress side. And then we covered the vitamin markers, and then showing some, just really not having as optimal detoxification capacity as what we'd like. Then we did a DMPS oral challenge, and what on the NutriBal looked like a little bit of mercury turns out to be pretty high, as well as some gadolinium and some tin. So then I do some labs where I can send them off to, it's almost like a research lab in Germany, and we found some really interesting things from her. We could see that her metallothionein function was elevated, so her body was really trying to deal with the metals. We could see that she had some aflatoxin sitting on her cytochrome P450 gene. So I think this is going to be the next step of what we're looking at with epigenetics, is being able to see some of these toxins sitting directly on the genes and then influencing the epigenetics from that. And then she had a lot of dental work done. So interestingly, one of those glass isomers was sitting on her growth hormone DNA. She had an elevated intracellular calcium, so her signs of cell membrane disruption. And then in a lymphocyte transformation test, she was reacting to a lot of these environmental toxins: the mercury, cadmium, aflatoxin, benzoquinone, glyphosate, the bromates, toluene, valine, triclosan. So her immune system was showing signs of heavy load as well. And then we were able to, through the same lab, we were able to do the serum and RBC glutathione and look at her glutathione peroxidase and see that she was really struggling with that. And then signs of hypomethylation, see a typo there, with the 2-to-16 hydroxyestrogen being off. So we really worked heavily on her microbiome and getting the nutrients in her in a form that she could tolerate, reducing inflammation, boosting up her detoxification with the liposomal glutathione and binders. She also did a few of the IVs with the PK protocol and the phosphatidylate, to really get her cell membranes cleaned up with that. And, put her on the nutrients to really support some of these detoxification SNPs. The other thing that was really fascinating about her story is she lives in an area with very deep lakes. So the water, they presumed to be pretty clean because the testing that they had done on the water was, didn't show signs of infection. So they had very little filtration on their water system. They would usually drink water out of plastic bottles, so we've switched that to glass, and then for the bathing and cooking water, gotten that more heavily filtered, because I think that's some of the problem with some of the older pesticides and that kind of thing. So now she's doing great. Her metabolism is back. She's really happy to be back to her normal weight with good energy. She's sleeping well. The night sweats have gone away. Her digestion is back to normal, and she can exercise again. She loves her Peloton bike. Now, the thing that remains to be seen, we need to go back and recheck the DNA adducts and see if we've gotten those cleaned up, and because I think that's really what it's going to take to get the parathyroid addressed I have a little bit more work to do, and we're continuing to optimize our microbiome. So I wanted to end with this slide because I love this. This is actually from a cancer article looking at what dietary things can really help prevent and treat cancer. And it's the best list that I've seen of the nutrients and how they can actually influence your genetic expression. So with the histones, you know, we've seen data on the curcumin being helpful, and now we really know, in addition to the, you know, the direct phytonutrient assistance that it gives, that it's changing the gene expression. And here's the others, so we all kind of know why those are working and why we probably all want to have this in our diet every day. So I think this is such an exploding field, but I think really looking at the patient's genetics and then integrating that with looking at the toxin exposure and where their microbiome is, what their nutritional status is, really helps to guide the treatment and getting outstanding results with patients. And then this epigenetics research, as we look at what our patients are coming in and presenting with, we can really help to guide what the priorities are as far as testing and treatment for them. And the thing that I'm seeing over and over and over again is these environmental toxins are heavily influencing the patient's gene expression and their you know, capacity to heal and to detoxify. We've got to be optimizing methylation on I've really started looking at with that for every patient, and I'm excited about where this new Genova methylation profile is going to take us at what I think is going to be pretty affordable for a lot of our patients. And the key takeaway, like when I start to talk with patients, like that they can influence what their genes are doing. They can modulate them in so many different ways by what they're eating, by sleeping, by exercising, by managing their stress. I think it's really empowering for them to take that away and help to motivate them to implement the changes that we're asking them to make. I think I have, oh my gosh, I finished early. I've got lots of time for questions.
Amazing, amazing. Thank you so much again for that wonderful presentation. We do have quite a few clinical questions that was asked. I'd like to start off just reminding everybody that the presentation and the slide deck will be available on our website within a few days of the webinar. And so you can access it through clicking the clinicians tab on the home page and navigating your way under webinar archive. And that way you'll be able to download not only this wonderful slide deck, but also hear Dr. Shippy's presentation as many times as your heart desires. So we have a few really great clinical questions that I'd like to pose to Dr. Shippy. The first one is asking for patients who have a heterozygous MTHFR and COMT gene, so your methylation genes, beyond taking methylfolate and methylated B12, what are any tips or suggestions that you may have?
Yeah, that's so, you know, I'm a lab connoisseur, so I'm so excited to do this for Genova today. I've been using a competitor's lab to, but I think that this new one from Genova is going to be even better. So I got the first patient running that this week, so I'll be able to report back on that in a couple of weeks. But what I like to do is start out with something simple like the methylated B12 or the methylated folic acid, and then see how that changes their methylation panel, you know, where we're looking at the homocysteine, the SAM, the SAW, the cystathione, any of the metabolites that we can that are in the methylation pathway, and see if those all line up. A lot of times that's all we need to do and we get a good result. But then when that doesn't, then I want to know more of the genetics than just the MTHFR. That's why I'm excited about the $100 add-on to, shouldn't quote the prices, but that's the price that's stuck in my head. It's about an extra $100. We can look at more of the genes in the pathway than just the COMT and the MTHFR to see where the glitches might be. So then a lot of times I find that adding in TMG and choline, if they have the BHMT polymorphisms, is helpful. And then, you know, higher doses of B6 with some of the other polymorphisms, and we just keep tweaking until we get the right dose for them. In fact, the patient that I saw this morning, I hadn't seen her in 2 years. She was just like, oh, I'm doing so much better now. I haven't really needed to come in, but I thought I'd, you know, she'll at least come say hello and see if there's anything else I need to do to fine tune things. And we had optimized her methylation pathway, you know, 2 years ago, and she just stayed on those same supplements. So what I tell people is, once we've optimized your supplements and your, you know, your diet for where we are with the methylation, if you ever change to a different brand or, you know, decide to change any of these types of supplements, we need to go back and look at that methylation panel again to make sure that you're still optimized. So this particular patient, she just was doing so great. She just kept everything on track for the whole 2 years. Did that answer the question?
Yes, thank you very much. Just so that our attendees are aware of what Dr. Shippy was referring to in terms of the new panel that was just released, it is our methylation panel. And Dr. Shippy was absolutely correct. We offer quite a few different genomic SNPs that not only impact the methylation pathway, but also your transsulfuration pathways. And we look at different metabolites. So we're trying to assess methylation through not only the phenotypic side, but also the genetic side. So here's another question that we received here. So it's in regards to mycotoxin, and we know that it can be very difficult to identify the source of mold. So Dr. Shippy, what is your approach for remediation and or clearance of mycotoxins from patients?
So that's a really complicated topic. I talk for hours on it, but I do have a handout. If you go to Ann Shippy MD/mold, you'll get a whole, like, it's got my basic testing that I do and the remediation. So, and you're exactly right that if the person tests positive for mycotoxins, it's coming from someplace, and usually it is from someplace in their environment, their home, their work, their school, or their car. There can be some from food, but that doesn't show up as well in the mycotoxin testing. If you think they've got a mold exposure and they test negative, a negative test doesn't rule it out, but you just have to keep searching for it until you find it. What I find is that a lot of the inspectors do tests that are no longer relevant. Like almost every inspector will tell you that they've done an air sampling test in a home and then later found it was right in front of a wall that there was hidden mold that they didn't see, and it just didn't pick up any of the spores at that moment. So what I found is the best way to test for an environment for mold is to do a dust swipe. And all of that information is in my handout where to get that, but you need to get plenty of dust and then check it for by PCR for the different mold families. There's one that'll check for 45 different molds, and then also check for the mycotoxins in the dust to really get a full picture of what's going on there. But I really think that this is one of the health epidemics in our country today. Even in 2000, a study showed that about 50% of the buildings in our country had some type of water damage, and thus probably had some opportunity for mold. And with all the heavy rains and flooding and that kind of thing that we've had in the last 10 years around the country, I think it's even worse. So it's really if you're doing all your regular functional medicine and the person isn't getting better, you've got to think about mold, because it has such a different effect in different people. You know, you can have 4 family members and they're all having different symptoms, or maybe only one person's sick because they're the first person for their barrel to tip over. So it's such an important topic. So thanks for asking that question.
Dr. Shippy, can you repeat your website again where people can access that information about mycotoxin testing and stuff like that?
Yes, it's annshippymd.com/mold.
Perfect, thank you. So another question we received was regard to how to support glutathione. Some people support glutathione directly, some people do IV. There's different oral forms. Some people go through the cofactors or the precursors. What tends to be your preferred method to help support those with glutathione struggles?
Yes, so I do a little bit of all of that, but I found the most effective way to raise the intracellular glutathione is to use liposomal. And I've become a liposomal glutathione connoisseur. We've got like 6 different, I think maybe 7 different types of glutathione in the office, and I'll use different ones in different circumstances. But you know, there are some really good companies for getting the liposomal glutathione. So the research nutritionals, theirs taste the best and it's easy to travel with because it doesn't have to be refrigerated. Medica has one that is soy-free, tastes okay, not great. One of my kids loves the Quicksilver. You know, it's just a pump. It tastes okay. You know, he likes it enough that he's 17. He reminds me, "Oh, Mom, I'm out of my glutathione. You need to grab some more at the office." And then for travel, there are a couple of different companies that have a capsule form of it. So anytime I see these polymorphisms in the glutathione genes, I go to the liposomal glutathione, and then sometimes I'll go ahead and support with some of the precursors like NAC and glycine, and but it really is a critical piece of getting people detoxifying. The IV, I do some of that with patients, but it doesn't get the sustained intracellular glutathione levels that we really need for good detoxification. So it can be a little boost, but I would always combine that with the liposomal.
So regarding, you mentioned one of the therapies that you utilize to help your patient is optimizing the microbiome. Can you briefly discuss what is your approach to helping support the microbiome? You know, some people just do probiotics, but what's your approach?
So I'm you know, the ex-chemical engineer in me really likes data. so I do a lot of testing. So I like to know, is the problem that some of the families of the beneficial bacteria, are they low? Do I have overgrowth of some of the frisky bacteria that, you know, aren't true infections, the, you know, SIBO kind of pictures? Do I have some bacteria that really shouldn't be there? So I don't think I showed any of the Genova testing, but I do a lot of that kind of stool testing to see where to target. And then I want to know how intact is the intestinal barrier. If I see low, you know, signs that intestinal barrier is permeable, you know, the leaky gut kind of picture, I will always supplement with things like the glutathione. I found an immunoglobulin powder that I really like now that doesn't have any of the gums and flavorings. It's just straight. That's very helpful for helping to do the repair. I'm really careful now with collagen. I in the past thought that that was a pretty beneficial thing, but I'm seeing too much increase in the histamines that I'm super careful to make sure that the person doesn't have a mast cell or high histamine picture. So there's some labs that we can do to look at that. And then one of the biggest things that I see is a lot of people actually really do need the betaine, you know, to increase stomach acid and pancreatic enzymes to get the food digesting enough that they're not getting some of the imbalance with the good flora. So it's pretty comprehensive. And then also I'm seeing huge impacts. I like checking a glyphosate level because I think glyphosate is one of the big things that's really disrupting the microbiome today. So sometimes we really need to do some intestinal detox with things like you know, clay and charcoal. I love the quicksilver binder for doing an intestinal cleanup.
For the first case study, the college professor, you did mention the use of hyperbarics. Can you elaborate on the use of it, the intention, the purpose, information like that, please?
Yes, that's a topic I love too. So the research on hyperbarics is really getting exciting. So, you know, back in my training, we used hyperbaric for diabetic foot ulcers, you know, to try to save them from having amputation. And that was about all I knew about it. But now the research is really coming out that the hyperbarics increase stem cell production. And that's probably part of why it was helping to heal the, it wasn't just the oxygenation of the tissues helping the patients with the diabetes heal, it was actually helping them make more stem cells to heal. And then there's a lot of data around brain trauma. So I've actually had quite a few patients now with traumatic brain injury or post-concussion, even if they're years out, do the hyperbaric and we get some benefit. So that data is pretty interesting. And then combining with the supplements that really help to rebuild mitochondria and cell membranes, amazing results with the concussions, even in a couple of patients that played football in college, and starting to see decline in their, you know, in their 30s and 40s. We've seen tremendous improvement by using the hyperbaric with it. And then the other exciting data that's coming out on hyperbaric is that it helps detoxification capacity. So especially in these patients that have these, you know, polymorphisms that make it harder for them to detoxify, the hyperbaric seems to bypass some of those glitches and accelerate the detoxification, because we see more of the toxins coming out in the urine after they do the hyperbarics. And then combining that with some sauna treatments, the infrared sauna treatments, has been super helpful, in addition to, you know, the supplements and avoidance and that kind of thing.
That is fascinating. I was only actually aware of hyperbarics for the use in infections, like you were saying, with diabetic neuropathies and circulation issues. So that's really interesting. I didn't know about the stem cells increase. Thank you. This last question I have is regarding water filtration systems. For case number 2, you did mention that she had that lake access in terms of her water source. So where do you send your patients to? Or do you have a preferred water filter system that you like? Is it at the level of the tap, the level of the house?
Yes.
Can you elaborate a little bit?
That's a great question. So, you know, a lot of my patients are around the country, so I don't just have one source, and a lot of it will depend on their budget. The best thing to do is to filter it right as it's coming into the house. So all the water, all the bathing water. So I'm really pretty convinced now that a lot of the contaminants are actually coming in through bathing. And then you can spend, you know, $1,500 with reverse osmosis, all the way up to, you know, 20 grand on a like Cadillac, Maserati level of water filter. So if you have, if you have well water or lake water, I would go on the upper end of that and, just find somebody in the area that's super knowledgeable about it. So the most extensive water filter that I've seen was, they did the best reverse osmosis, and then they put a major carbon filter and UV filter on it at the, in the garage at the source of the water coming in, and then additional at the sinks for the drinking water. They probably had some of the cleanest water in the country with what they were doing. But they were people that had the resources, and then they were just super motivated, with the health things that were going on in their family.
One more question popped up here. Is there any emerging evidence about the role of epigenetics in male infertility? I know you mentioned something briefly about toxicity in fertility, but what else do you know in regards to that topic?
The only things that I've seen on that are the toxins. So, the plastics were huge, when reviewing the literature, but it's just such a big issue that we're seeing, linking the different toxins. It's everything from, you can go in and find on the mycotoxins and fertility. I mean, there's so much animal research on the mycotoxins and animals affecting fertility. So, with these other things, I can bridge the gap that a lot of this it's the epigenetic influences of the toxins leading to the infertility. I think methylation has got to be a big win there too with male fertility, and there's a lot of work coming out on the effects for even when men are fertile, what the epigenetics play a much greater role than we ever thought for what's passed on to the children. So what the weight is of the father, what the some of the dietary components, having an impact on the phenotype of the baby. So I think this is a really important, as we're seeing such an epidemic with infertility, both in men and women, come up. But it's amazing to me the number of young men that I've seen that have low testosterone. An interesting study that I just saw the other day, I think I'm rambling a little bit, but I was just so impressed by the study. It's a fairly recent study on boron and all the different things that boron can do to help to raise testosterone. So I think this can be, the work was in men, but I think it's probably a factor with men and women. So extrapolating a little bit, I do think that some of these nutritional deficiencies that we don't even have a way to check for could potentially be an impact on the male fertility factor.
Wow, thank you very much. Well, in the interest of time, we're going to go ahead and end our question and answer session right there. Additional education materials, again, they will be on the website at www.gdx.net, and or you can always contact client services as well for assistance with regards to that website. We also offer complimentary appointments with our medical education specialists to answer questions related to our testing, including choosing the right test and even reviewing patient test results. We finally would like to encourage our participants to go to our website and register for our upcoming webinars. Next month, we will have Dr. Elizabeth Board presenting on utilizing nutritional testing in pain management, and several dynamic speakers to follow in the upcoming months, including Drs. Christine Stubbe and Dr. Michael Chapman as well. Just as a reminder, again, all of our materials regarding the webinar, the presentation, the recording will be on the website. And for the information regarding mycology and testing, you can refer to Dr. Shippy's website at Ann Shippy MD. And then I believe you mentioned / mold.
Yes.
Perfect. So I want to thank everybody again for attending our webinar. I wanted to thank Dr. Shippy also for a great presentation. Have a wonderful day.
Thanks for joining us.